Welcome to the session. You've already done the heavy lifting of memorizing definitions, but today we are shifting gears because the RBT exam doesn't just test your vocabulary, it tests your ability to make critical decisions. While competitors often provide simple lists of prompt types, the real exam challenges you with nuanced scenarios, such as managing a frustrated learner or supporting a student who is almost independent but still hesitates. To succeed, knowing the what simply isn't enough. You must master the why and the when, so you can confidently choose the right tool for your specific learner in that critical moment. The stakes of mastering prompt strategies are incredibly high because they directly impact three critical areas, starting with client progress. A well-executed strategy accelerates learning and builds confidence, whereas a poor choice can cause frustration and stall development. Next, understanding these techniques is vital for your exam success, as prompting scenarios are a heavily weighted portion of the RBT assessment, where choosing the right strategy determines your final result. Finally, we must avoid the hidden trap of prompt dependence. Without a clear plan for fading prompts, we risk compromising a learner's long-term independence, which is our ultimate goal. To effectively guide learners through complex new tasks, we rely on three primary strategies within our specialized prompting toolkit. First, most to least, or the safety net, provides maximum support initially to guarantee correct responses and minimize learner errors from the start. Next, least to most acts as the independence builder by starting with minimal assistance and only increasing support levels if the learner actively struggles. Finally, time delay, our efficiency engine, introduces a strategic pause before delivering a prompt, giving the learner the necessary space to demonstrate their skill autonomously and build confidence. Moving into our first specific tool, let's look at tool number 1, most to least, which we often refer to as the safety net. If you look at the blue icon in the center top, you'll see a graphic of two hands, where one is physically guiding the other. This is the perfect visual representation of this technique. In most to least, or MTL, the instructor provides the highest level of support necessary right out of the gate to ensure the learner is successful immediately. Under the What It Is section, you'll see this method is also known as errorless learning. Think of it like a set of training wheels that are so stable the bike literally cannot tip over. You start with the most intrusive prompt, perhaps full physical guidance, to guarantee the learner responds correctly every time. From there, you systematically fade that support as the learner becomes more independent. It is a proactive approach rather than a reactive one. So when do we pull this tool out of our belt? As the When to Use It section suggests, this is ideal for teaching brand new skills or working with learners who have a low frustration tolerance. If a student has a history of giving up when they encounter a challenge, MTL builds what we call behavioral momentum. By ensuring they succeed on the first try, we build their confidence and prevent the learner from practicing the wrong response, which can be very difficult to unlearn later. Finally, let's look at the evidence and the corresponding bar chart on the right side of the slide. The chart, titled Errors per Session, provides a stark visual comparison. Notice the tall gray bar on the left, labeled LTM for at least to most. It shows a significantly higher number of errors. Now look at the much shorter blue bar for MTL. As cited in the 2008 study by Libyan colleagues, most to least prompting is consistently associated with fewer errors during the initial acquisition phase. By starting with high support, we essentially net the learner before they can fall into an error, making the learning process smoother and more efficient. Moving on to our second tool, we have least to most prompting, which we frequently refer to as the independence builder. If you look at the green icon next to the title, you'll see a set of stairs. This is the perfect visual metaphor for this approach. We start at the very bottom level of assistance and only climb higher to more intensive prompts if the learner truly requires that extra support. It is fundamentally designed to prioritize the learner's own autonomy from the very first trial. So, what exactly does this look like in practice? In a least to most sequence, the instructor first allows the learner an opportunity to respond completely independently. We pause and wait. If the learner doesn't respond or makes an error, the instructor then provides the least intrusive prompt needed, perhaps a subtle gesture or a verbal hint. We only increase the intrusiveness or the strength of our help as it becomes necessary. We are essentially giving the learner just enough help to succeed, but no more. Knowing when to use this tool is key. It is most effective for rapid learners, those who tend to pick up new skills quickly. It's also ideal when a learner already possesses some components of a skill, or if you are trying to assess their level of independence on a skill they've previously mastered. It prevents us from over-prompting and creating a situation where the learner becomes dependent on our help for things they can actually do themselves. Now, let's look at the evidence. Every strategy has a trade-off. As noted in the evidence section, least to most can lead to a higher number of errors during the learning phase because we are giving the student a chance to fail before we step in. However, research by Libby et al. In 2008 showed that despite those errors, LTM can lead to faster overall acquisition. In their study, 60% of participants, 3 out of 5, learned their targets more quickly using this method than with other prompting styles. Finally, let's visualize the speed on the right-hand graph, labeled acquisition speed. On the vertical axis, we see the Sessions 2 criterion, and on the horizontal, the learner profile. The bright green line represents LTM for those rapid learners we discussed. Notice the steep angle. For these specific individuals, LTM facilitates a much faster path to mastery compared to the gray line representing most to least prompting. While LTM is safer for avoiding errors, LTM is the high-speed rail for students who are ready to take the lead in their own learning. Moving right along to tool number 3, time delay. We frequently refer to this as the efficiency engine because of how effectively it transitions a learner from needing help to providing independent answers. You will notice the small stopwatch icon next to the title. This represents the core of the strategy, the intentional use of time as a teaching variable. So, what exactly is it? As outlined in the What Is section, time delay is when the instructor inserts a set amount of time between the initial instruction, or SD, and the controlling prompt. Imagine you are teaching someone to use a new software. Instead of clicking the button for them immediately, you ask them to find it, and then pause. That pause is the window that allows the learner to try and respond independently before you step in with a prompt. When do we use it? This is crucial for transferring stimulus control. We want the natural cue, the instruction itself, to trigger the behavior, not our help. It is the perfect tool for skills that a learner has demonstrated in the past but hasn't yet mastered with 100% independence. It builds fluency by encouraging the learner to beat the prompt. Let's look at the visual workflow on the right to see this in action. The instruction is given, what letter? Below that, we see the downward arrow leading to our efficiency engine, the stopwatch. Notice the circular arrow indicating a count of 1, 2, 3 seconds. We are waiting. If the learner fills that silence with the independent response A before the 3 seconds are up, they have succeeded without needing a prompt. Finally, I want to highlight the pro tip from research at the bottom. While you can use a constant time delay, where the wait is always the same, research by Zink in 2018 suggests that progressive time delay, or PTD, is often more efficient. In PTD, we might start with a 0-second delay and gradually increase it to 2, 4, or 5 seconds over multiple trials. This results in fewer errors and reaches the mastery criterion much faster than staying at a fixed interval. Now that we've covered the types of prompts, how do we decide which one to apply in a real-world session? This RBT decision tree provides a systematic roadmap for that choice. We always begin at the top center. What is the learner's profile and learning history? Effective ABA is never one-size-fits-all. Our choice of prompting must be data-driven and individualized based on how that specific student learns best. Following the path to the left, we ask, is the learner new to the skill or prone to errors and frustration? If the answer is yes, we utilize most to least prompting, or MTL. You can see the icon of 2 hands meeting here. It represents high levels of support. The goal is errorless learning. By providing the most intrusive prompt first, we ensure the learner is successful immediately, which prevents the development of problem behaviors often triggered by repeated failure. Conversely, on the right side of the tree, we look at learners who acquire skills quickly or already possess some prerequisite skills. In these cases, we use least to least prompting, or LTM. Notice the stairs icon. This represents a progression where we give the student a chance to perform independently first and only move up to a more intrusive step if they don't respond. This method is fantastic for promoting independence and assessing exactly where a student's skill level lies. In the center, we address a specific middle ground. Has the skill been acquired but is not yet fluent or independent? This is where time delay, or TD, comes in. Represented by the stopwatch icon, this involves waiting a specific number of seconds before delivering a prompt. The primary goal here is to transfer stimulus control from the teacher's prompt to the natural cue in the environment, increasing overall efficiency. Finally, let's look at the pro tip box at the bottom. A common question is, what if I don't know the learner's history? Perhaps it's your first day with a new client. In this scenario, the default recommendation is most to least with a time delay, MTLD. As noted in the reference to Libby et al. 2008, research suggests that while LTM is fast, MTLD produces significantly fewer errors, making it the safest and most effective default choice for an unknown profile. Moving forward to slide 8, we encounter what is often described as the villain of behavioral therapy, prompt dependence. As the title emphasizes, this phenomenon directly sabotages a learner's path to independence. In our practice, we spend a significant amount of time teaching essential skills. But if a learner cannot perform those skills without a therapist or parent hovering over them or providing cues, we have to ask ourselves, have they truly mastered the skill? True mastery means the environment itself triggers the behavior, not the presence of a helper. Prompt dependence essentially tethers the learner to the instructor, preventing the very autonomy we are striving to build. To ground this in clinical terms, look at the definition on the left, which is cited from the Missouri State University fact sheet. It defines prompt dependence as occurring when a student requires a prompt to complete a task that has been previously mastered. This is a critical distinction for you to remember as RBTs. If you are teaching a brand new skill, prompts are necessary and expected. However, once the data shows they can do it, yet they continue to wait for a nudge or a verbal cue before acting, you are dealing with dependence. An analogy would be an adult who knows how to cook a meal, but refuses to turn on the stove until someone specifically tells them to start cooking every single day. So how do we identify this villain in a real-world session? We have a checklist of signs to watch for. The first sign is when the learner physically waits for a prompt before responding. You might see them sitting with their hands in their lap or hovering over a material, completely still, waiting for that specific go signal from you. Their body language is stagnant because they are waiting for the external motor of your prompt to start their own movement. Next, pay close attention to the learner's visual focus. Are they looking at the task or are they looking at you? If the learner looks at the instructor expectantly instead of looking at the puzzle, the book, or the fork, they aren't engaging with the natural environment. They are scanning your face for cues on what to do next. Furthermore, a major red flag is when a learner simply will not complete a task or answer a question without a prompt, even though they have the motor and cognitive ability to do so. They have become passive recipients of instruction rather than active participants. The final and perhaps most telling sign is when accuracy drops to 0 as soon as prompts are removed. This is often a jarring realization for therapists. If a learner is 100% accurate when you are gesturing or providing partial verbal cues, but then fails completely the moment you fade those prompts, it tells us that stimulus control has not shifted. The instruction is coming from you, not the task itself. Let's analyze the illustration on the right to visualize this dynamic. Here we see a young learner at a desk with several puzzle pieces. If you look at his eyes, he isn't focused on the orange or blue pieces in front of him. Instead, he is looking upward and away toward the hands reaching into the frame from the top right. Those hands represent us, the instructors. He is waiting for those hands to guide him or point the way. This visual perfectly captures the expectant look we just discussed. Our ultimate goal in ABA is to fade our presence so that those hands move out of the frame entirely, allowing the child to focus solely on the puzzle and complete it independently. To successfully transition a learner to independence, we need a systematic escape plan for our prompts, as outlined here. Start by establishing a fading plan on day 1, moving gradually from high-intrusive support to less intrusive methods, while offering higher quality reinforcement for unprompted successes. Conversely, avoid getting stuck on a single prompt level or over-relying on verbal prompts, which are notoriously difficult to fade. Data should always dictate your speed, and crucially, never end on an error. If a fade fails, re-present the trial with more support to ensure the learner finishes with a win. Moving on to a critical concept for your certification, look at the top of the screen. This exam alert banner signals that the scenario we are about to analyze reflects a very common real-world problem you will encounter in both the field and on the test. We need to evaluate a lack of progress and determine how to adjust our clinical strategy. Pay close attention to the details in the scenario text on the left. We have Zach, a 15-year-old, who is struggling with a new Lego building task. The data is clear. He hasn't moved past step 3, and this has persisted for 22 sessions. That's nearly a month of intervention with 0 progression. Furthermore, we see behavioral indicators of frustration. He's making errors and pushing materials away. This is a classic sign of learned helplessness, or simply a task that has become aversive because it is too difficult under the current prompting hierarchy. The illustration of the Lego structure on the right represents the complexity of the skill Zach is trying to master. To us, stacking blocks might seem elementary, but when a client is stuck, it's often because our teaching method isn't providing enough support. Currently, the plan uses least to most, or LTM, prompting. LTM is fantastic for maintaining independence because it gives the learner a chance to perform the skill on their own first. However, if a learner is consistently failing and making errors, LTM is actually reinforcing those errors and leading to the frustration we see Zach exhibiting. The goal of any behavior intervention is to provide the just right amount of help so the learner experiences success rather than repeated failure. Now, let's look at the question: what is the RBT's best course of action? When we look at the options provided below, we have to choose the one that most effectively addresses the lack of progress. Option A suggests continuing with LTM. We can immediately rule this out. 22 sessions of data show that LTM is not working for this specific task. Option C suggests removing the task entirely. While it's true the task is currently too difficult, we don't want to abandon skill acquisition, we want to modify the approach. Option D, a time delay procedure, is a way to fade prompts, but it doesn't solve the issue of Zach not knowing how to perform the step correctly to begin with. This leads us to option B, switch to a most to least, or MTL procedure. In ABA, we often refer to this as errorless learning. By providing the most intrusive prompt first, perhaps a full physical hand-over-hand guide, we ensure Zach completes the step successfully every single time. This eliminates the errors, reduces his frustration, and allows him to contact reinforcement immediately. Once he is successful with the high-level prompt, we can systematically fade back to less intrusive prompts. In an exam scenario, if a client is consistently failing with a least to most strategy, the clinical best practice is almost always to move towards a most to least strategy to build confidence and accuracy. Pay close attention to this exam alert, as the correct answer is B, switch to a most to least, or MTL procedure. The rationale for this change is based on Zach's learner profile. He was making frequent errors and showing signs of frustration, which tells us that the initial prompting strategy wasn't working. By following our decision path shown on the right, we see that for learners prone to errors, the structured safety net of MTL is the most effective choice. In the Libby study referenced here, this switch allowed Zach to master the chain in only 6 additional sessions, highlighting the importance of matching the procedure to the learner's specific needs. Let's break down the scenario provided in the text. We have a client named Ian. 2 pieces of information are critical. First, Ian is described as a rapid learner, and second, he has already mastered several similar kitchen tasks. This tells us Ian has a strong repertoire of foundational skills. However, the technician is unsure of the exact level of assistance he needs for this specific sorting task. When you are unsure of a learner's ability, but know they have a history of quick acquisition, you must choose a strategy that balances support with independence. The visual on the right represents the task at hand, sorting silverware, specifically a fork, a knife, and a spoon. While this seems simple, for a learner, it involves discrimination and motor planning. Because Ian has done similar tasks, we shouldn't assume he needs us to move his hands for him immediately. Looking at the question and our options, we need to decide which strategy is the most appropriate to start with. Option A suggests a full physical or most to least approach. We typically use this for brand new skills where we want to prevent errors entirely, but for a rapid learner like Ian, jumping straight to full physical guidance would likely be intrusive and could hinder his natural learning pace. Option B, time delay, is a great tool for shifting control from a prompt to a natural stimulus to build fluency, but it isn't usually the starting point for assessing the necessary prompt level. Similarly, option D, verbal prompts only, is too restrictive. If he fails a verbal prompt, we haven't planned for the next step of support. The correct choice is option C, least to most, or LTM. As highlighted in green, LTM is specifically designed to allow the learner an initial opportunity to respond independently. If Ian can sort that fork, knife, or spoon on his own, LTM gives him the space to do so. If he struggles, we then move up a hierarchy of prompts, perhaps a gesture or a model, until he is successful. This strategy is ideal when a learner has some prior experience or is a quick study, as it ensures we are providing the least amount of help necessary while still guaranteeing success. Everything we've discussed today aligns directly with the RBT Task List 3.0, as these skills are core competencies tested during your certification. In Domain C, Behavior Acquisition, your ability to use prompting and fading correctly is vital for tasks like DTT and chaining, representing 25% of your exam. Moving to Domain F, Ethics, selecting the right prompt is a direct application of Task F1, which requires treating others with compassion and dignity. By utilizing effective prompting strategies to minimize client frustration, you are not just teaching a skill, you are adhering to the highest ethical standards of the profession. When you are unsure where to start with a new learner, your primary recommendation should be most to least with a time delay, or MTLD. Research by Libby and colleagues suggests this is the optimal default response prompting technique when a child's learning history is unknown. As shown in the central graphic, MTLD provides the comprehensive safety net of most to least prompting, while integrating a time delay to encourage independent responding. This approach effectively balances error reduction with instructional efficiency, giving you a solid framework to build professional fluency. Visit myrbtprep.com to practice these prompting scenarios and master the application of this framework in the field.